Epidural blood patch. I have a model here we're going to use here. Come on down. So you can actually see her spinous process is pretty well. So hunch over just a little bit. You see that? So if I was to grab her iliac crest here, Topier's line would be right around here, and you can actually see each one there. So when you get an epidural, you're good. You can relax. When you get an epidural, come back real quick. We're going to go into one of these spaces here. We're going to numb the skin up first. Then we're going to go in with the epidural, similar to the other video that I have that I showed you. Whenever we go a little too far, it happens. It's rare, but it happens. When we go a little too far, we actually go into an area in the spinal cord that has fluid in it. You can sit right there now. I think we're good for now. And I'll bring you back in a second. The area that has fluid in it will leak, okay? And this will cause what we call a spinal headache. It's rare, but it does happen. It's non-life threatening. You won't get paralyzed from it, like a common misconception that is heard kind of around the world. But you will get a headache from it. There's two options when you do a dural puncture. Is you can thread a catheter into the area, and you can still have pain relief, very similar to an epidural. The second option is you pull everything out and you either go up a level, and you try to do it again. From my experience, I personally don't like threading catheters into the subarachnoid space, but some people do. It's just not my preference. If ever I do get a dural puncture, I'll pull out and I'll just go up a space. I am aware though, the next day, even that night, if they begin to show symptoms of a spinal headache, I will go ahead and blood patch, and that's the whole point of this video, is to explain how a blood patch works. Can I use you one more time? And a blood patch is basically going to be me injecting blood into the same epidural space to patch the hole that I've caused into the dural, into the dura. So for her, let's just say she was to have a dural puncture. She'd be sitting on the bed again in the same position as we did when we were doing a normal epidural. I would have someone drawing the blood from me. So she'd be hunched over like this. This is after she's delivered, even maybe the next day, and she has a dural headache, or she has a spinal headache. I'll do the same thing. I'll get the epidural. I'll hit the epidural space. Someone is going to be drawing blood from me over here sterilely. They're going to sterilely draw me 20 cc's of blood. They're going to hand that to me sterilely. I'm going to inject slowly. This is painful for the patient. So I'll inject slowly. Once I get to about 5 cc's, she might start to say, I have pain, and that's okay. You just keep going slowly. The goal would be to get 20 cc's in here to totally patch that area there with blood and create a clot there. But 15 is adequate, even 10 is adequate if they're just in serious pain. You do want to go a level above the puncture site, because that will allow gravity to play a role and really patch that area. You're good, thank you. And so that's essentially a blood patch to help with the spinal headache. So for my people out there who get epidurals, or if you're getting one in the future, if you get a headache after your epidural that's severe and it only gets better when you lay flat, you may need a blood patch. And like I say, it's not very common, but it happens. And if you do get what we call a wet tap is when we go a little too far and we get into the actual subarachnoid space. You can ask, you may be told by the person who did your epidural, the anesthesia provider, hey, you had what we call a wet tap. We're still going to provide you pain relief, but there's a high probability you have a headache either later on today or the next day when once baby's delivered and you're kind of resting. The headache is not fun. It hurts quite a bit. And it does not go away unless you lay flat. And this is because a lot of the fluid in the spinal canal, for lack of a better word, it's called CSF, cerebral spinal fluid, is leaking. And unless we put a patch with blood back there to stop the leak, it'll just continue to leak out. Now, will it eventually close and seal itself off? Yes, it will, but it could take days. Sometimes it takes weeks. And if you lose too much of that fluid, you can have bigger problems. So the best thing is to do an epidural blood patch as soon as possible after a dural puncture has occurred. That's about it. That's the whole goal of this video, is to explain how a blood patch works and kind of have a model and show you her. She has really good you can see her spinous process is really good, and so she should be a chip shot, what I like to call epidural. but sometimes those are the type that you actually end up doing a dural puncture on, because one, you may be overconfident, two, her epidural space is a lot closer than what you expect, and sometimes you can even get close to that spinal canal with just your lidocaine, where you numb the skin up with. So this is for patients and providers and people in education and who want to learn about this stuff. So anyway, hope you liked the video.